Before you begin with the priming procedures, press the on-off switch on the back of the power supply to put the Medos console into operation. Make sure that you have the right Nova Lung kit for the treatment. Check the kit for damage in transit and check the sterile packing. Open the packaging and the sterile outer packaging and ensure that the content is complete. Switch on the Medos console. Push and hold the on-off button on the front of the Medos console for at least 2 seconds. Please put on sterile gloves to ensure aseptic technique during the arrangement of tubing lines in the sterile box. First, remove the supplied accessories from the packaging and put them on your table. Then open the tapes. Remove all protection caps and short tubing parts from the colder couplings. Connect the filling bag with the table set via the colder couplings and check all 3-way stopcocks and connection caps for tightness. Hang the priming solution onto the infusion hook. Take out the Nova Lung kit and position the oxygenator onto its corresponding holder. Hang the table set on the system trolley. Make sure not to hang the table set higher than the height of the oxygenator. Then hang the filling bag on the infusion hook. Remove the transportation lock from the pump head, but do not insert the pump head yet. Close the 2 tube clamps of the filling bag. Connect the sweep gas line at the gas inlet of the oxygenator. Then remove the white caps from the oxygenator. Now prepare the HC unit. Therefore, please also consult the corresponding IFU. First, de-air the HC unit. Then connect the water hoses of the HC unit to the water inlet and water outlet connector of the oxygenator. Switch on the HC unit, set your target temperature, and allow the water to circulate. Check the oxygenator for leakage. If water should occur in the gas exchange compartment, replace the Nova Lung kit. Now attach the flow sensor to the tubing set. Attach it after P3 with notice to the direction of the arrow. Connect the integrated pressure sensor cable to the corresponding IPS. Please note the correct order of P1, P2, and P3. Here, please also refer to the instruction of use of the Medos console. Select the therapy mode Lung Assist on the Medos console. After completing the startup procedure, a visual imaging of the sensor box with the connected cables will appear on the display. Select the pressure measurement mode as shown. For this, use the integrated pressure sensor. Now calibrate the pressure sensors. Ensure that the Nova Lung kit does not contain priming solution. Spike of the filling bag into the priming solution. Hang the filling bag downwards and allow the priming solution to fill the bag. Hang the filling bag on the infusion hook with a minimal height of 50 centimeters, for example above the table set, pump head, or oxygenator level. Open the clamps and wait for the passive filling of the set. This will take approximately 30 seconds. Tap the pump head lightly to remove any remaining air inside. Now connect the pump head to the pump drive. Connect the recirculation line to the vent port of the oxygenator. Open the clamp of the recirculation line in the three-way stopcock of the vent port. Remove the yellow cap from the oxygenator. Actively vent the tubing set in the de-airing mode with 3000 RPM as shown. Remove the oxygenator from the holder. To allow for complete de-airing, turn it on the side and tap it lightly to remove any remaining air bubbles. Then place the oxygenator back onto the holder. Remove the de-airing filter from the oxygenator and close the lure lock with sterile lure caps as shown. Once there is no more air inside the tubing system, deactivate the de-airing mode. Now calibrate the flow sensor as shown. For calibration, please close the clamps of the filling bag. Optionally, you can activate the function Zero Flow in case of air bubble after closing all 4 tube clamps. Disconnect the filling bag from the tubing system. The priming is completed.